LaTrina Frazier. I'm the Assistant Service Director of Medical Facilities Service. That includes all of non-long-term care, which means all hospitals, home health agencies, ambulatory surgery centers, dialysis facilities, hospices in the state of Oklahoma we regulate. We also regulate emergency medical transport services, and our area also oversees the trauma fund that is distributed to providers. So in my job, my responsibility is more regulatory. It's the regulatory side of public health, and we look to ensure the safety of the citizens and anyone that travels through the corridor of Oklahoma if they have to receive any type of medical care. We're there to ensure that they're safe. I think some of the highlights and some of the rewarding experiences in public health have been that I've gotten to have opportunity to speak to different providers, provide education on regulations, which sometimes translate to their care system and their model and how they're doing it, and to be able to have that conversation back and forth to where they can bounce things off of you and you can just be there to be a listening ear, knowing that each provider has their own individual way of doing things. It's always good to give them the mindful perspective of regulations and requirements. And in having that conversation too, it allows them to know that you're not out to get them, that you're here to be a support and to be a help, which is something very important in the regulatory area, because a lot of times when they see us, it's a lot of fear, it's some intimidation, and so it's not always a good feel to see that we're walking through the door. But at the end of it, it's been my experience that after a while they realize that I'm rooting for them, that we want them to not have any deficient practices, and that we want them to be the best provider they can be. And so it gives them more of an outlook of a partnership instead of someone being out to get them, or just saying that, we're here to tell you what you're doing wrong. A lot of our education is to provider type facilities and agencies, but the one thing that we do get to do, which is something that I really enjoy, is interacting with the providers. And so we have various associations that invite us out to speak or invite me out to speak, and that probably is the highlight because I do get to interact, I get to answer questions, I get to be a partner, I get to tell them all of the areas that are areas of importance for them, and also get to know what their concerns are. And so it helps us to address anything that is a highlight of an issue, because sometimes it's important to know what the provider sees as important so that you can be that resource. And it always gives me that sense of excitement, and it's a reality reorientation to what's going on out in the public, and so that they know that we're aware, we're available, we're concerned, and we want to be a help. So that part is always the most exciting. If I could do that every day, I would.